So I've been tagged in another video explaining why herbal supplements can cure end-stage renal disease and get people off of dialysis. So I want to preface this by saying that I'm not a doctor, I'm a nurse, right? So I'm not getting paid to lead people astray. Plants make up like 80% of the medicine that we all take. There's a cancer drug called Taxol that's made by a plant. Aspirin is made by a plant. The heart medicine, digitalis, is made by a plant. So plants make drugs. Like drugs don't just come from chemical factories, like things are added, but plants make drugs. You may think that herbal supplements can help you with any kind of health concern that you have, and they may in some cases, but if you already have chronic kidney disease or end-stage renal disease, you have to be very careful about these herbal supplements. A lot of research has shown that herbal supplements are great, but the thing is, herbal supplements are also drugs. Herbs are drugs, they are. So if you misuse herbs or if you misuse drugs, that can have some harmful or even lethal effects. So one, don't diagnose yourself. Talk to a doctor, get advice. You can always do whatever you want to do anyway, but still talk to a doctor first. If you're a diabetic, make sure that you take your blood sugar before you take any of these supplements, then take it again afterwards. Like wait half an hour after you take your herb and take your blood sugar again, because a lot of herbs can increase your blood sugar. A lot of herbs have a lot of potassium. A lot of herbs has a lot of phosphorus. So you want to make sure that these herbs that you're taking aren't going to do more harm than good. So don't forget also that if you have kidney failure or kidney disease, your kidneys aren't working like they should. Kidneys clean and filter the blood. When it filters the blood, it also filters it of different medicines. So if you take herbs and the herbs are filtered by the kidneys and your kidneys aren't working properly, then guess what? That herb or drug may build up in your body and cause more damage than good. So before you use any kind of herbs, find out if your kidneys filter it out. Find out if it raises your blood sugar. Find out if it raises your blood pressure. Find out the phosphorus content, the potassium content. Does it thin your blood? Does it make your blood clot, etc., etc.? And also don't forget some herbs may interact with prescription meds that you have, like your diuretics or your beta blockers, your blood pressure medications. So find out all these things before you just randomly take these herbs. Talk to your doctor, talk to your pharmacist, see if they interact with any of the current drugs that you take. You can keep a symptom diary. You can start a diary and say, okay, I started this herbal supplement on this day at this time. And if you feel a certain way afterwards, like you itch or you feel nauseated, write that down. Like keep a track of what these drugs are doing to you. And also don't forget that, like I said, a lot of these herbs are good for people without kidney disease, but some of these herbs can actually really cause damage to your kidneys. Nettle, I keep hearing about nettle. Nettle is not good for you if you have chronic kidney disease. Parsley, the thing that you use when you cook, like almost every day, is not good if you have chronic kidney disease. Juniper berries, there's more and more and more. So herbal supplements is pretty much good for people without kidney disease to an extent. Find out what it does to you, but it's unsafe for people with CKD or ESRD to just randomly trust these random videos and just take these herbal supplements. Don't buy them from random people who have 800,000 followers who want you to go to their TikTok shop, because especially if your kidneys can't clear these herbs from your body, it could just build up and just cause so much damage, and you don't want that. Don't forget that the FDA does not regulate herbal supplements. They don't regulate the dose, the content, the pureness of the product to make sure you're getting that actual product. A lot of herbal supplements that are made overseas may have heavy metals in them. So make sure you read the label. Make sure that the herbal supplement you're taking isn't a combination of a bunch of different herbs, because if you're looking for a specific herb and the herbal supplement that you're taking has that plus 5 others, what's the percentage of the herb that you're actually looking for in the first place? Maybe it's so small that it won't even do anything for you. And maybe those other herbs that's in there may cause damage because it interacts with your other medications, or just are bad for you in general because you have kidney disease. So To sum it all up, it's not recommended for CKD patients to use herbal supplements. If you use it, talk to your doctor, talk to your dietitian, talk to your PCP. Let them know that you're taking these supplements so they can at least update your medication list so they can figure out why your beta blockers aren't working because they're using this new supplement. Always check with them before trying anything new. Don't forget that this is like a multi-billion-dollar business. You may hear from friends that, hey, this worked for me, it really worked for me, but do they have CKD? Do they have ESRD? Like, you really have to be smart about what you're putting in your body. Didn't mean to make this long video. Take care. Ciao.